Leading doctors in the United Kingdom are calling for some coronavirus prevention measures to remain in place to try and stop an alarming rise in cases. The call from the British Medical Association comes as Prime Minister Boris Johnson prepares to outline whether he will end England's COVID restrictions on July 19.
With a big England game, this should be one of the busiest days of the year for pubs. But COVID restrictions are expected to reduce the number of pints sold by 5 million, according to the British Beer and Pub Association. At the Willoughby Arms in Kingston upon Thames, the landlord says the final step in lifting lockdown can't come soon enough.
Everyone's got to be seated throughout and they've all got to be served at the table. So we've got capacity for 160 people to sit, which means we've got to cover how many people come in the door. Subsequently, we've done all ticket in advance for all the England games, but all those people that are sitting down have also got to be served. So it's almost tripled my staff force for a game like today.
But the British Medical Association warns some COVID measures should stay. It wants masks to be worn on public transport and in shops, and it says there should be legal standards for ventilation.
Whilst the link with hospitalisation has been weakened, it's not been broken, and that some measures should continue. But what it should not be doing is giving people the impression that we will have a pre-COVID society by that stage. We would be the only nation that I'm aware of in Europe that will be taking that stance at a time when our infection rate is about 10 times higher than that in France or Italy, for example.
With a little over 2 weeks until Freedom Day, cases are surging, up 74% in a week. Lifting the last of the restrictions will accelerate the virus's spread still further. But it's better to relax the rules now, says this virologist.
At some point, whenever we finally lift all the restrictions off, we are going to see a surge. And I think the reason why I'm arguing the way I am is because I think it's better to have that surge in the summer than it will be in the winter when we've got other pressures on the health service and we may well have increased numbers of cases of influenza with the increased mortality that would bring on the COVID.
With almost 2/3 of adults now double jabbed, protection of the most vulnerable is high, and the rollout is progressing rapidly through young people who are more likely to spread the virus.
We are enjoying a vaccine dividend. 1 dose halves the chances of the virus spreading. 2 doses reduce the risk of hospital admission by more than 90%. They are so effective, the government is considering scrapping the need to quarantine for double jab people if they come in contact with someone who's infected.
The Prime Minister has said extra measures may still be needed beyond July the 19th. It's likely people will be encouraged but not legally bound to take precautions in confined spaces.